Hi class, my name is Jenny Sanchez and I'm going to be doing my presentation on congestive heart failure exacerbation. So the patient AC is a 62-year-old Latino female who was admitted to the intensive care unit for acute exacerbation of congestive heart failure. AC currently works as a housekeeper at a hotel. She came to the US when she was 25 years old. She attended school back in her home country but did not attend college here in the US. She has been married for 24 years and lives with her husband. She has 2 adult children who are married and have their own families. She also has 2 grandchildren of ages 4 and 8 years old. She works full-time and she lives with her husband in an apartment. AC was diagnosed with congestive heart failure 2 years ago. She is on a loop diuretic, Lasix 40 milligrams BID, and a beta blocker, low pressure 25 milligrams BID. She also follows a regular diet. She goes on walks occasionally from time to time, but sometimes with her work schedule doesn't have much time for anything else. She usually attends all her doctor visits, but sometimes she misses because she cannot get the day off from work. She checks her blood pressure from time to time, and sometimes she also misses her scheduled medications. AC is also overweight and usually does not watch how much fluid she drinks. She tends to get swollen feet often, especially after being on her feet all day at work. The diagnosis of CHF is so new to her and her husband as she still is getting adjusted to all the new changes. For nursing diagnosis, AC has deficit knowledge related to the new diagnosis of heart failure, misinterpretation of information, and unfamiliarity with the new importance of treatment. Also, deficit knowledge. AC also needs extensive patient education regarding her chronic illness, the importance of pharmacological and non-pharmacological treatments, as well as the importance of being compliant with her medical treatment. Self-care capacity with illness and treatment. AC lives at home and she is completely independent. She works full-time. She cares for herself. She is ambulatory. She completes ADLs independently. She does all the cleaning and cooking around the house. She's able to shop for groceries and communicate her needs. However, she does miss her doctor's appointments and she forgets to take her medications at the scheduled times and she does not follow her medical regimen. To be able to manage her new diagnosis of CHF, she needs education on the importance of following her medical regimen, education on the diagnosis itself so she understands what is going on in her body, and she also needs the skills to know how to take her blood pressure, manage her diet, and exercise appropriately, and also have proper diet. Priority issues for discharge planning. AC needs to be able to manage her CHF at home. She needs to be compliant with her medical regimen, which includes checking her blood pressure, taking her medications on time, eating healthy, exercising, and going to her follow-up doctor appointments. She also cannot miss taking her medications and her doctor's appointments, and she also needs support from her husband and her children. They need to be aware of her disease process and be her support system as well. Where can the patient be discharged? AC is independent. As I mentioned previously, she is independent. She's able to complete her ADLs. So she should be able to there should be no problem being able to discharge her home, of course, with the support of her family and home health. She can be discharged home because she does independently care for herself and is able to understand the information provided to her. However, she does need home health for some time so education can be enforced and so she can be stabilized and so her blood pressure, weight, and eating habits can be assessed for a longer period of time. Nursing case management strategy for the patient level. Medical compliance, exercise, healthy diet, and blood pressure checks. AC is completely independent and able to care for herself. She can identify when she's not doing too well and take herself to the doctor. She can complete tasks around the house, prepare herself meals, take her medications, and take her blood pressure. She also has support from her husband and children. After providing AC with education regarding her illness and the appropriate medical management, she will be able to prepare meals that are healthier for her, exercise, take her medications, and check her blood pressure independently. Her family will also be supportive and encouraging. At the system level, medication education, disease process education, medical management, and home health. AC was hospitalized for 5 days because of her exacerbation. While in the hospital, she was provided with education from the doctors, nurses, dietitians, and pharmacists regarding her heart failure and medical management. Providing the patient with the importance of her illness can result in a positive change such as compliance. Knowledge of disease process and expectations can facilitate adherence to prescribed treatment regimen. Lastly, to further improve her adherence to her medical management, home health was also prescribed. This will allow for further education to be provided in the comfort of her own home. Home health will be able to provide her with medication education, disease process education, family participation, and provide support with diet and nutrition as well. Patient-level intervention. Knowledge of disease process and expectations can facilitate adherence to prescribed medical treatment, according to Lewis, Dirksen, Height, Kemper, Butcher, and Harding in 2015. Educating AC on her disease process is important. She needs to be able to understand her disease, know what to look out for, and know what to expect. She also needs to be involved in her treatment course. System-level intervention. Home health will be able to provide her with medication education, disease process education, family participation, and provide support with diet and nutrition, according to Bayada Home Health Care. For AC to be discharged home, she will still need some home care services. Home health will be able to provide her with the further education she needs and provide her with the additional support, such as diet, nutrition, medication management, light household chores, and one-on-one focus support. According to Bayada Home Health Care, research has shown that clinical results are comparable or better with fewer complications when home care is provided to individuals with chronic conditions. Utilization review. Assessments, medications, education, treatment, home health, follow-up appointments. Was she properly given the treatment desired? AC was properly assessed during her stay in the hospital, and she also sees a cardiologist. The medications she has been prescribed are appropriate and has been educated on her disease as well as her medications. To fully recuperate, she will also receive home health care services and follow up with her primary care provider. All the care provided has been appropriate for her chronic illness. Quality and safety issues. Was there good communication between the staff and the patient? Was the patient provided with safe and quality care? Was the patient discharged appropriately? Was the patient provided with quality treatment? Yes, the patient was provided with appropriate, safe, and quality treatment. Nursing case management effectiveness at the patient level. The nursing case management intervention at the patient level will be effective if AC's goals have been achieved. Her goals are to be compliant with medications and treatment. That includes taking her medications on time, seeing her doctors regularly, eating healthier, exercising. She also needs to independently be able to manage her chronic illness. Nursing case management effectiveness at the system levels would be reduced hospitalizations and medical treatment adherence. Nursing case management effectiveness level at the system will be achieved if her hospitalizations are reduced and she adheres to her medical regimen. And that is all. Thank you.